Some new mums and mums-to-be will experience perinatal mental health problems that can be treated by their GP, midwife and health visitor. Other women experiencing more complex mental health problems can be referred to and looked after by our specialist community perinatal mental health team, which is open to women registered with a GP practice in Hull, East Riding, North Lincolnshire and North East Lincolnshire areas. Referrals come through to us from anyone who has had contact with the mum or mum-to-be, such as a midwife, a health visitor, or a GP who feels that she would benefit from some specialist help. We also offer advice for women who are thinking about having a baby and who have been diagnosed with a mental health problem. They can see psychiatrists for support and guidance on things like becoming pregnant safely whilst taking medication and to reduce the risks of relapse with plans of care. When a referral meets the service criteria, it is important that you feel included in what happens next. From here on, our approach is to do this together. An assessment is a meeting between a member of the team and a woman. It usually lasts an hour to 90 minutes, and together we talk through many different things, such as what has happened in the past, what's happening for them now, and any medication that they're taking. We take a whole family approach. We encourage women to bring someone close to them to the appointments. Babies are also welcome. The outcome of the assessment might be that the woman doesn't need an intervention. If she does, we agree on what type of intervention that should be and who will be involved in her care. Interventions are the types of help women can get. For example, if it's a pregnant lady with a fear of childbirth, known as tocophobia, or one who has experienced a traumatic birth in the past, we would look at how to make that pregnancy less anxiety-provoking and as comfortable as possible. We would do what's called mental health birth planning, which is different for each individual. We make sure that the woman's needs are met and communicated with the maternity team, such as the midwives, along with the support of a psychiatrist and other members of our team so that they get the best possible care for their individual plan. Many women come to us for help after their baby is born. Lots of mums struggle with all the ideas of, I should be feeling this, or it should be the most amazing experience, when actually it's really hard. It's tough, it's draining, and you've not slept for so long. It might be that the birth wasn't what you expected, and it's caused quite a lot of worry and anxiety. So we look at all of that and we agree what might help. That might mean a psychological intervention, such as from a cognitive behavioural therapist, or we can refer on to primary care so that we can do something with the emotional wellbeing team. Our doctor may also review medication, which for many of our women plays a crucial part in their recovery.
As a specialist nurse, I assess a woman's needs on an ongoing basis to see how they're getting on and whether we need to tweak any plans they've got, whether they're mental health birth plans or whatever it takes to make sure mum and baby are well. We work as part of a specialist team along with cognitive behavioural therapists, perinatal psychiatrists, occupational therapists, social workers and nursery nurses. It's an honour to work with women. They want it to be as special as possible and talk about the most sensitive things in their life. You can see the drive that these women have and how they just want to make everything okay. Your trust that we are on the same side is vital. I suppose some people think if they say one negative thing, it will be used against them to try and take their baby away, which is never our goal. It will always be about how can we make this better for them. There's no better feeling than discharging someone who's well and confident with their baby. It's amazing. Don't delay in getting some support. Nothing bad is going to happen by asking for help. All our team want to do is to help you get well and make sure you're feeling good by getting symptoms under control so you can enjoy being a mum.